Have you ever been in a situation where you or someone you know suffered a head injury, experienced stroke-like symptoms, or had unexplained headaches? In such moments, the anxiety can be overwhelming. What's really going on inside your head? That's when doctors might turn to one of the most powerful tools at their disposal, the CT scan. It's fast, efficient, and can provide life-saving answers when time matters most. But, it's normal to wonder, what exactly is a CT scan, why would you need one, and what should you expect during the process? We'll walk you through all of this step by step, breaking it down in a way that's simple and easy to understand. Whether you're nervous about an upcoming scan or just curious about how this technology works, we've got you covered. By the end of this video, you'll know exactly what happens when a doctor orders a CT scan of the head and why it's a go-to diagnostic tool for so many conditions. What is a CT scan and why is it done? So, what exactly is a CT scan, and why is it so important? A CT, or computed tomography, scan uses X-rays to create detailed, 3D images of your skull, brain, and other parts of your head. Think of it as taking a peek under the hood. This scan can reveal things a regular X-ray can't, especially when doctors are looking at soft tissues or blood vessels. Now, why might a doctor order one? Well, CT scans are often used in emergencies. Let's say someone hits their head falling off a bike or in a car accident. Doctors use CT scans to quickly check for brain bleeding, fractures, or other injuries. But it's not just accidents. If someone has stroke-like symptoms, a CT scan can show if there's a blood clot or bleeding in the brain. It can even help doctors track the progress of treatments, like seeing if a brain tumor is shrinking. If you've ever felt dizzy, experienced memory issues, or even had personality changes, a CT scan can help doctors see if a brain abnormality is the root of the problem. In short, it's one of the fastest ways to get a clear, detailed picture of what's happening inside the brain. When a CT scan is necessary. There are many reasons why a CT scan is crucial. Let's break down a few. 1. Head injuries. Whether it's from a fall, a sports injury, or a car accident, head trauma can lead to brain bleeding or fractures. CT scans help spot these issues quickly. 2. Stroke symptoms. When someone is having a stroke, every second counts. A CT scan can reveal if a clot or bleeding is causing the stroke, helping doctors act fast. 3. Brain tumors or abnormalities. If a doctor suspects a brain tumor, a CT scan can provide clear images to confirm the diagnosis and plan treatment. It can also show if a treatment is working, like shrinking a tumor. 4. Congenital conditions. For children born with skull abnormalities, a CT scan can help doctors assess how the skull is forming and decide on the best treatment plan. These scans are a doctor's eyes on the inside, giving them critical information to make quick, informed decisions. What to expect on the day of the CT scan. Now, if your doctor has ordered a CT scan, what should you expect? Don't worry, it's a simple, painless process, but there are a few things to know ahead of time. First, your doctor will give you specific instructions, like whether you need to avoid eating or drinking for a few hours before the scan. Also, if you wear jewelry, have removable dental work, or use hairpins, you'll need to take them off. Why? Because metal can interfere with the scan's images. For those who take metformin, a common diabetes medication, your doctor may ask you to stop taking it for a day or two before the scan. This is especially important if your skin involves contrast dye. What is contrast dye? Let's talk about contrast dye. Sometimes, doctors use a substance called contrast dye during a CT scan. It's injected into your body, making certain areas show up more clearly on the scan. But here's the thing, not all scans need contrast dye. If yours does, the radiology technician will usually put N4 in your arm before the scan begins. You might wonder, is it safe? Generally, yes. But, there are some risks. Some people are allergic to the dye, though that's rare. More commonly, you might feel a warm sensation, or even a strange metallic taste in your mouth. Don't worry, it goes away quickly. Your doctor may give you medicine beforehand to prevent any allergic reactions if you're at risk. What happens during the CT scan? So, what actually happens during the scan? When you enter the room, you'll notice the machine, a large, donut-shaped scanner with a bed in the center. It's open, which is a big relief if you are worried about feeling claustrophobic. You'll lie on the bed, and a radiology technician will talk to you through a speaker system, letting you know what's going on. As the scanner sends X-rays through your head, you won't feel a thing. The process is quick, typically just a few minutes. If you're getting contrast dye, the technician will pause the scan, inject the dye, and then restart it. Afterward, they'll check the images to make sure they're clear. Special considerations for children. Now, if your child needs a CT scan, there are some extra things to consider. Kids are more sensitive to radiation than adults, so doctors only recommend CT scans when absolutely necessary. The good news is, modern machines can adjust the settings to minimize radiation exposure. For young kids, staying still can be a challenge, so the procedure might be done with light sedation or anesthesia to ensure they're comfortable and the scan results are accurate. Risks of radiation exposure. A common concern is the exposure to radiation. It's true, CT scans involve radiation, and excessive exposure can increase the risk of cancer. But, the amount of radiation from a single head CT scan is low, and the risk is minimal. If you're concerned, ask your doctor about the radiation dose and how it compares to the benefits of getting clear, detailed images. Pregnant women are often advised to avoid CT scans unless absolutely necessary. In some cases, the benefits of the scan might outweigh the risks, but it's a conversation to have with your healthcare provider. CT scan vs. MRI, which one is better? You might also wonder, should I get a CT scan or an MRI? Both are great, but they have different strengths. A CT scan is faster, more affordable, and can be used if you have metal implants, like a pacemaker. An MRI, on the other hand, doesn't involve radiation and is better at showing soft tissues, like the brain's membranes. For emergencies, CT is the go-to because of its speed. But for certain conditions, like detailed views of soft tissue abnormalities, an MRI may be the better choice. It all depends on what your doctor is looking for. Conclusion. To wrap it up, a CT scan of the head is a powerful, non-invasive tool that gives doctors crucial insights into what's happening inside your skull. Whether it's assessing trauma, diagnosing a stroke, or checking for brain tumors, it's a key part of modern medicine. And while it does involve some exposure to radiation, the benefits often far outweigh the risks, especially when fast and accurate diagnosis is needed. If your doctor has recommended a CT scan, it's normal to have questions. But now, you're equipped with the knowledge to feel confident and prepared. Talk to your doctor if you have any concerns, and remember, the scan is one of the best ways to get quick, clear answers about your health.